This is lateral line fascial stretches. I'm going to redo this video so I can add in a couple of changes and take away some stuff that I don't use too often in clinic. But the first one is the 90-90 lateral line fascial stretch, or 90-90-90. And we're dealing with the whole chain, all the way from the toes to the fingertips. And so the 90-90-90 is 90 degrees, 90 degrees, 90 degrees. And then you pin the knee to the floor. And then get on the elbows and face the opposite direction. Okay? And so essentially the goal of this is to get as much space between your fingertips and the knee as you can. And so you'll be here, and then we're going to reach on the ground, breathe, and then every breath, exhale, go farther. Every breath. 6 breaths or so, 4 to 6 breaths. Essentially, I just say, do it until you feel like you've made a change and you can get more distance there. And that's the first part. The other thing is stay tall over here. This is your base of support. A lot of patients will do this, they'll do this. Stay long and stay supported over here. Okay, and then come back to here. On the old video, if you remember, I had a thumb up. I don't really do that anymore. That's the part I'm going to take out, and we'll just go straight to hand up and reach. And again, every breath, go farther. You're staying up tall on this shoulder, and the point is get the rib cage down and reach. Make sure you're holding tension the whole way through, like so, and breathe. And then the part I'm going to add in that, if you've seen the old video, is we come up like so to get some stretch in the hip and a little bit through here. I always tell patients I don't value this much because I don't get a hip stretch, but some people do, and they like this transition piece. But then reset all your pieces, and then crawl down into child's pose and reach as far as you can with that same hand and breathe. And that's 90-90-90 lateral line fascial stretch. We'll go into, stay there, but and then we'll go into the global postural stretch for negative torsion. So if you think about the torsion of the ribcage, positive torsion, negative torsion. And so the other video, if you remember, I had my leg pinned underneath a squat rack bar. So you can put this underneath a bed frame, squat rack bar, chair, couch, anything you need to hold this down, or have a buddy hold it down. But we're going to bring this leg back about 120 degrees, other foot on the knee, and then pin the knee to the floor. That's important. Pin this ankle to the floor. Locks in the hip, knee to the floor, locks in the pelvis, and we need to get the back flat. And people don't, it's hard to know what that means, but you can push the back to be flat, or if you're not sure, just crunch down a little bit. It's okay to be crunched here, as long as the lower back's flat so that it doesn't take up slack in rotation. This is your pillow, and then hand behind the head. Patients will do this, they'll do this, they'll do this. The head means the head. And the goal is to get the shoulder blade on the rib cage to act as a pivot point or a fulcrum. If it's here or here, it doesn't have the same effect. So hand behind the head. And then again, breathe. And on exhale, you're trying to get here and here to the floor behind you. And breath, just same thing. Every exhale is where you want to go farther. This knee stays pinned. If you have a buddy at home, they can hold this down. They can help push you through here. But from patient experience, if they're doing that, don't let them let go. Just slowly come out of it, because that can be pretty sore if they just leave you there. The one thing I'm going to add into this video is foam roller. And I didn't do it before. I've been working on it, and I'm a little bit concerned about rib injuries, so my disclaimer is stay on your full rib cage, don't go down below it. Any osteoporosis, penia, any rib issues, if this hurts, just don't do it. And there's different densities to foam rollers. Less dense is better, or put a blanket on top, but this is the best way I've found to actually get the inside fascia to start loosening up. And so, be on your side, and it's the same kind of thing as those lateral lines. So we're going to be in fetal position, back flat, kind of like the global postural stretch we just did. This hand just lays here. Same thing, that's behind the head. Bend over the foam roll. You don't have to sit there and wrench on it. Just let your body do the work. Or let gravity. Breath in. Hold the breath so that it opens this rib cage up from the inside. And then let it go. And then allow yourself to fall down a little bit more. A lot of times we'll go on a couple different positions. You can get your lat or your serratus in here. Sometimes it's tender. Just kind of move out of the way or move the foam roller down a little bit. Go into the next position until you get down toward the bottom in a real bucket handle motion of the rib cage. Again, make sure you're still on the ribs. Straight sideways. Breath. Hold. And let it go. And now, the important part is we're going to roll backward, kind of like the global postural, trying to open up the front side of the rib cage on the right side here for this video. Same thing, breath, breathe out, and fully extend over the top to get motion throughout your mid-back and rib cage. And then a few breaths there. Then we go into the 90-90 position and come over the top. Women, breasts usually should be above. You don't squish yourself. Otherwise, you want to be on the low end of the rib cage. Again, it should be fine here. This is the position I'm more concerned about. You're going to lay on it, and just like the last part of that 90-90, you're just going to go into child's pose and breathe over the top. And what this will do is open up the backside of the rib cage here, so it gets your full bucket handle motion moving better throughout the rib cage. And those are the lateral line fascial stretches on the floor. Okay. This is the rib torso. It's called a stretch, but it's more of an activation move. Have something like a cell phone, cards, a piece of paper that you can squeeze. Some people can't get their knees together, so I give them a shoe or something bigger to squeeze, but you need something like an input device to keep your knees together that locks in your pelvis. Right ankle over left ankle. Clasp the hands, interlace them behind your head, and then elbows back. That locks in the shoulders. And then in this position, we're gonna right ankle on top, so we turn to the right. And then before you get to bend, a lot of people will let their elbows come forward, they'll slouch, get tall, elbows back, and then you get to earn bending to the side. 2 to 3 breaths in through the nose, out through the mouth, and then come out of it, but don't lose your rotation. Elbows back, go farther, bend, and when you're in that position, lift the opposite rib cage, elbows back, stay tall, 2 to 3 breaths, and then come back out of it. And then you'll switch ankles, and then repeat going to the left, elbows back, stay tall, bend, and lift that rib cage. If you're noticing everything falling, it's harder than it looks. And so up, over, and let that whole thing come down, and then lift that opposite rib cage. And that's the rib torso stretch. Hey, this is the 3D torso stretch, or 3-dimensional torso stretch. We're gonna pin our hands against the wall. The top hand's gonna be above your head. A lot of people do this kind of a thing, and they're leaning through. So try to get it as up high as you can, and it should be, make it difficult for yourself if you can't quite do it. And then this hand right here. We're gonna be here, and then we're gonna lean away from the wall. You're gonna do that 5 times. And a lot of people, if they're not moving well here, they'll just kick their hip out. And so what helps is to push hard against the wall, and then that'll open up this whole lat and chest and ribs and everything there. So 5 times. 4 against the wall, away from the wall. That's one direction. And then the next direction is to come forward. And the problem patients have is they'll want to twist or torque, or else they'll just come forward, but you want to act like you got headlights or something right here on both sides, and push those straight forward. And again, 5 times with that one. And we're opening up hips. Some people feel it here, some people feel it here, most people feel it here. But so don't worry if you don't feel it exactly where you think you should, but just keep going. And then the next one is to reach. And the last mistake people make is that they're not pushing through with that hip. And so reach all the way through. It's not just doing this, it's all the way through. And again, 5 each one. And try to get this done both sides. You'll turn around and do the same on that side. Try to get it at least once, if not 2-3 times a day, to help open all this up. This is a child's pose lat stretch for the lat muscles all the way from your shoulder down into your lower back. It's to help open this up when people are unable to bring their arms above their head, and to get the shoulder blade onto the rib cage and help out shoulder strength here. So you're going to get down onto your knees, and if you can get your butt onto your heels, that would be best. If not, just get it as close as you can. That's the goal there. And then you're going to come down and reach out as far as you can, and then reach all the way to one side, and then push, pull, reach as far as you can with this inside hand here, like there's something just out of your reach that you're trying to push farther and farther. And take about 3-4 breaths in and out in this position, and then come on back to center, and then walk yourself all the way out to the other side. And again, reach with this hand over here as far as you can, like there's something that you can't quite get at. And then the farther down you get, the more of a stretch you'll get versus staying upright like this. So try to do your best to get down on that one. And then come back to center.